So hello, everyone. Thank you guys for being here so much today. I know these later meetings, 5:30 is dinner time, so it's always tough to get to a meeting at this time, but I appreciate you all being here to learn a little bit about this COVID-19 community training that the California Consortium for Urban Indian Health put together. As I mentioned earlier, seems like COVID is kind of not really being talked about as much anymore as the holidays are coming up. And we thought it was really important to really just kind of go through some data and go through some talking points about how you can talk to community members and encourage them to get vaccinated, especially with the holidays coming up. So my name is Wyatt Kelly. I'm a public health coordinator here at CCUIH, and I am here with my partner, Taya Lopez, who I'll let introduce herself.
Hi, everyone. My name is Taya Lopez. I'm the public health coordinator at CCUIH, and I've just been assisting Wyatt on this COVID training and also just all of the COVID work he's been doing. And I'm excited to be here with y'all tonight.
Great. One second. Okay, so a little bit about CCUIH. CCUIH was established in 2006. We're a nonprofit 501c3 statewide alliance of urban Indian health programs and substance abuse treatment facilities, collectively referred to as UIHPs. California is home to 10 urban Indian health programs, and we actually represent all 10 of them. So we represent the full spectrum throughout California for urban Indian health programs. And with these urban Indian health programs, we work on a lot of projects, and we're in constant collaboration on things for the community statewide that the community needs and wants. So we're constantly working to bring these trainings to you, bring any efforts we can to help the community in any way all throughout California. So that's just a little bit about us. And I wanted to go ahead and just put out this resource. This is our California Hope Red Line that was established during COVID-19. And this is a COVID-19 support line. And it doesn't have to be related to COVID-19, just to let you know. This is a line, video, phone, email, call, text, any type of chat you want to. We have people on the line, always ready to go, ready with resources, ready with referrals. They can guide you on any questions you have related to getting care, getting treatment, anything it is. Our COVID team can definitely help you. And this is a great resource. And I just tell everyone in the community to please use this red line, because our employees are trained, they're culturally relevant, trained to be there to help you specifically, to help our Alaskan and Indian natives really just kind of get the care they need. So please do use this resource. It's available Monday to Friday, 8 a.m. to 7 p.m. And they're just, the team is so good, and I just can't thank them enough for being on our team. So please do use this team if you need them for, like, let's say you want to get a vaccine appointment, or you're in a really rural area and you don't know if there's a mobile clinic near you, or where you can get a vaccine, or when you should get a booster, or any of these questions. Just a text away, a phone call away, and they're there to help you. They're just an amazing resource. So please do use this resource. Screenshot it if you need to. I'll go ahead and include it in the email. I include it in almost all of my emails. So please feel free to use the Cal Hope Red Line when you can. They're just an amazing resource, as I said. So a little bit about this training. I was in conversation with our team at CCUIH, and one thing we wanted to do was figure out a way to talk about COVID-19 a little bit more and bring in some community members. And one thing that we thought would be important was to train community members on really how to break down the data, how to talk about COVID-19 with their family members, because we know it can be a little bit hectic, and it can start a lot of arguments when it comes down to opinions surrounding COVID-19. And I know personally, I've tried to talk to a couple friends about the vaccine, and it kind of gets into a fluster of talking or an argument, and we want to avoid those. So we wanted to put together a training to talk about COVID-19 and talk about how you can better talk to people in your family and your community about COVID-19. So this is a little bit of data that I broke down, and I wanted to mention that this data is available every single week at the cdc.gov. You just go to cdc.gov and you can Google like COVID-19 data ethnicity, or by ethnicity. You'll get this chart, and it'll show you the cases week by week. And as you can tell, that our American Indian Alaska Native communities are still disproportionately affected by COVID-19 in the cases and death. So we need to start informing our communities about how we can change this. And you can see in the graph here, it's kind of significant. This is per 100,000 population on the left, and you see it's a very wide line between American Indian, Alaska Native, and the following, which would be the African American communities here throughout the US. So this just goes to show that, we are still being disproportionately affected. And although we are hearing some success stories in some communities throughout the entire states, we're actually not doing the best. So it's really important for us to talk to our friends and our family and encourage them to change these numbers and to make a change in our community. So a little bit about the vaccines. Oh, Taya, did you want to talk a little bit about the vaccines?
Yeah, I can go ahead. All right, so I'm going to be talking about the vaccines. So as you know, there are 3 vaccines available right now. There's Pfizer, Moderna, and Johnson & Johnson. And I'm not really sure where everyone's background level knowledge is on vaccines. So I'm just going to be discussing a little bit about how they work before I go into these specific ones. So all 3 of these vaccines for COVID are mRNA vaccines. And for those of you who don't know, mRNA is kind of like little instruction manuals for our bodies on how to build proteins. So in the COVID-19 vaccine, the mRNA is an instruction manual for how to build a spike protein, which is on the outside of the coronavirus. So when we get the vaccine for COVID-19, our body is going to use that mRNA to build and express these spike proteins on our cells. But our immune system is really smart, so it's going to recognize it, and it's going to recognize it as an invader and attack it and get rid of it, which is why we kind of get those weird like sick feelings after getting a vaccine, you know, the fever, headache, body aches, chills, whatever those are. And that just means that your immune system is working. Your immune system recognized the vaccine as something that should not be there, or the parts of the vaccine as things that should not be there, and it's working to get it out. But because these spike proteins are not full viruses and don't have anything to do with the replication process of the virus, they pose no threat to our body while our body is getting acclimated to it and figuring out how to get rid of it. So that's why vaccine is so vital to us fighting COVID vaccine. So the reason why we go through, you know, putting the mRNA in our body, getting that little bit of sickness feeling, is because our adaptive immune system is really smart and is going to keep a memory of these spike proteins, how to attack it and how to get rid of it, so that the next time your body is exposed to them, your body is going to know much better how to get rid of it. So it's going to attack quicker, more efficiently. So that's why you see less hospitalizations for those who are vaccinated but still get COVID, because your body just knows how to get rid of it more quickly and more efficiently. So also really important to note here is that the Pfizer vaccine is FDA approved for ages 12 and up, whereas Moderna and Johnson & Johnson are an emergency use authorization for ages 18 and up. So the FDA approval just means that the Pfizer vaccine has gone through extensive and rigorous testing and review just to prove that it is safe and efficient at preventing really bad illness occurring for people who do get exposed to COVID-19. And then our last little note here at the bottom is please don't forget that our vaccines, please don't forget that our smallest warriors are our strongest medicine. So we really want to keep our smallest warriors, our strongest medicine, keep them safe and strong. And so we really want to keep this in mind when we're discussing, you know, those who are unvaccinated. It's not always people who don't want the vaccine, it's also the children that can't get vaccinated. So making sure that we're using our best practices to keep our children safe from COVID, and keeping this in mind when we discuss vaccines for children in the coming months. Next slide, please. All right, and then as we know, Pfizer also has a booster shot that just recently got FDA approved for certain populations, including the 65 years and older, long-term care facility residents who are 18 and older, people with medical conditions who are 18 and older, and employees and residents of high-risk settings for COVID-19 exposure and transmission who are 18 years and older. So these are a lot of really specific categories that could have some gray area, you know, what is a medical condition and what is a high risk setting. So if these are a little bit confusing, the CDC website has much better detail as what qualifies as high risk and medical conditions. Or if you're unsure if you qualify or need the booster vaccine, you can also reach out to your primary care provider, or like Wyatt said earlier, Redline has some really good resources for that as well, just to figure out if you do need the booster or if you qualify for it. And then at the bottom of the slide, as we were making this, the rule to follow was that you were supposed to have received the Pfizer 2-dose series before getting the Pfizer booster, and the spacing between these two are supposed to be 6 months. However, this might change in the future, not the 6 month part, but that you had to have received the Pfizer 2-shot series in order to receive the Pfizer booster. The FDA actually met today to discuss the safety of like mixing and matching booster doses. So say you received the Moderna 2-shot dose and you want the Pfizer booster shot. They're going to be discussing the safety of that today. So we might get some updated information even today or in the coming days. Furthermore, Moderna and Johnson & Johnson are both currently working to get their own booster shots approved. So you might see that coming in the future as well.
Thank you, Taya. This next slide is just a little bit on the importance of community leaders such as yourself for being here today and promoting vaccine confidence and rollout throughout our communities. So through communication, community leaders just as yourself can help turn these questions into confidence and ultimately end up saving lives just by talking to people, which is insane. So I just wanted to put a slide in about the importance of people like yourself and the importance of people who take this time to really learn about how they can impact the community and make a change. And strength, as we know, comes through our community. And if we can make a change through our community and we can inform a little bit more people in our community, then we're going to end up making a change. And CCUIH is always here to offer resources and highlight community leaders such as yourself. So if there's any work or anything that you see that you think our community needs to hear at a widespread audience, then please do share that with us, because we would really love to highlight what it is, the work you're doing, the things you're seeing, and the things that you think our community needs as well. So right now, vaccines are our best tool to fight COVID-19 in the community, and the support of people like yourself is really what's going to be essential to getting us back to this normal. And although I don't think we'll ever really have a normal like we used to, I just think it's so important for us to really get together and talk about this and really help our elders out, because I'm just really sad and really tired of hearing the stories of elders passing away and people passing away to COVID-19 when in fact there's something out there that can help this, and that's getting the vaccine. And I really hope that through this training and through you talking to community members, that we'll be able to mend this little gap and really get the last of the last people vaccinated in our communities. So a little bit about success stories that we've seen in our community. Navajo Nation has been doing amazing with their successes in terms of getting the vaccine out. And as we know, like, that was one of the first communities that we were seeing really hit hard by COVID-19. It was all over the news. Like, Navajo Nation is, it's just insane how the cases were insane. And the fact that they were able to come together through community leaders, through messaging, and really just destroy it, really make a change is so heartwarming, and is something that we need to see throughout all of Indian country. So this is just some success stories that we see in Navajo Nation that we too can follow. And if we keep talking to our community members and we keep talking to our community leaders and we keep pushing this conversation about the vaccine and getting COVID-19 and getting the vaccine and why it's so important, then this is really what we're going to end up seeing in our community. Is we're going to see a really good change and a really good rollout in terms of the vaccines. And I just want to bring up, like, as the boosters are coming out too, like, just stay informed, just continue to inform your elders and continue to inform the community about it. And I know it's been really hard with the rural communities, and we've been working. We're working on a larger grant with Together Towards Health, and in this Together Towards Health grant, we've actually developed a native-led committee where we have every organization that is receiving a grant through this is actually coming together weekly to discuss COVID-19 and what we can do better. And one of the things we wanted to do was talk about boosters and talk about vaccines and just keep that conversation going in our community. So this is just one example of what we can see in our community if we continue to keep doing the work that we're doing together. So how should we communicate to build trust? This is one thing that I was thinking through constantly. As I mentioned earlier, I've been in conversation with some friends and some family where it's kind of turned out to be kind of sour, because just the approach of how we were talking to each other wasn't necessarily right. So I wanted to go ahead and put this slide in here to kind of talk about what I saw in my personal experience and what I think would ultimately help. So the first point I have here is to be gentle with misperceptions. We're so quick to jump on misperceptions, and especially if you're coming from a background of academics or research, and you're constantly always seeing research and always reading research and always around the data. Not everyone is like that. Not all your elders are around data, or they may not even have anyone talking to them about data and what's going on. So conversations surrounding misperceptions and misinformation need to be handled very gently, and you really need to be really gentle with combating that information and try and oppose these people with facts, and be very gentle with approaching those facts, and really just try and meet them where they're at. Try and meet people where they're at with their COVID-19 knowledge and expertise and their opinions. Just if you can, really meet them where they're at and try and pivot it instead of focusing on whether it be the news or whatever is going on. Try and pivot it back to COVID-19, the virus itself. Because one thing I've realized with all the conversations I've been having around COVID-19 is there's so much misinformation and so much bad media out there. And people love to attach to this media and attach to this misinformation and really hold it close to them. And in doing so, if you're just going to keep attacking that misinformation, whether it be a post or the whole thing with the magnetization in your arm, you really have to pivot the conversation back to just to COVID-19, the virus itself, just the virus. Just talk scientifically about the virus. I'm sorry, I'm gonna mute myself. There was a fire truck going by. Sorry about that. But yeah, just pivot the conversation back to COVID-19 and try and come at it from a scientific approach and less of a media approach, because I have been seeing, even as time goes on, the media just seems to keep getting worse, and there seems to being more and more misinformation around the vaccines and especially around the booster shot. And I know like everyone's just constantly attacking the booster shot, like, oh my God, like why do I need to get a vaccine if like I need a booster now? Like, is everything working, this and this? So just try and come back at it in a scientific perspective, and then use nudges and defaults, apply presumptive communication, use values in our beliefs. That's one huge thing is we're here to protect the next 7 generations and to protect our youngins and to protect our elders. And no one wants, nobody wants their grandma or their language carrier to pass away. So really try and use our beliefs as a backing of how you're talking about COVID-19, and use it as a way to really hopefully persuade someone to make the right choice in getting the vaccine, especially now with powwows being, I know like powwows are back in person now and all these huge events, and it's great. It's so beautiful to see everyone coming back together and wearing their masks and being together. But I know that a lot of people are still not vaccinated. So please do use those nudges and defaults and use our background and our culture to really hopefully persuade our elders and persuade our youngins to really get the vaccine. And I know FDA approved 12 and up, and there's a lot of kids back in school, and that's where we're seeing it through the data predominantly being spread. So please do encourage those young youth to really get the vaccine. And I know it's definitely a hard choice to make, but it's definitely the smartest choice for our elders and for our families. And then the last point I put here is just to build trust through empathy. We've all been going through so much in COVID-19, and we all can empathize for one another and everything that's happened. So I think it's just super important to really find that connection through empathy, find that connection where you guys share common ground through the horrible things that have happened. As bad as that sounds to say, we have to empathize with everyone and everything that's been going on. And I feel like a majority of people have lost someone close to them or know someone who's lost someone close to them through this virus and through the spreading of COVID-19. So please do use that as a point to really a talking point as to why it's so important, because we don't want to lose anyone else, and we certainly don't want to hear about someone else losing someone else. So we wanted to put this in because we thought this was a really great section. This is questions that we have been getting from the community surrounding COVID-19. And these are the commonly asked questions. And we thought these would be great to talk about, as if they're the most commonly questions coming to CCUIH, you guys are probably getting them as well. So we wanted to go ahead and put some answers in there and kind of just work through these questions that we've been getting asked a bunch of throughout the COVID work. So I'll go ahead and turn it over to Taya to kind of walk us through some of these question and answers that we've been getting from our community.
Yeah, thanks, Wyatt. So first question, are the vaccines effective for all COVID strains? So far, yes, the available data suggests that it works against all variants of the virus known to be circulating. Like I said, these strains contain mRNA for the spike protein, and so far, all variants have had the spike protein. Why not take my chances with COVID is the second question. COVID is by far the more dangerous option. So although people who are older and have other health problems are at higher risk, young people can still become severely ill, and as many as 1 in 3 people who recover from COVID have complications, also known as long COVID. So the COVID vaccines, in contrast, carry little known risk. So like I explained earlier, the vaccine gently, for lack of a better word, introduces your body to COVID by acclimating it to a small piece of the virus that poses no threat to your body while your body is getting used to what it is, how to deal with it, how to get rid of it. So by obtaining natural immunity, by getting COVID, you're exposing your body to the whole virus all at once. So by the time your body figures out what it is, that it's not supposed to be in there, how to get rid of it, and getting rid of it, the virus has had all that time to attack your body. And it's just kind of like starting the race after the virus. So the virus has already had time to start replicating and infecting you. Meanwhile, if you had the vaccine, your body already knows what to do and can get started a little bit quicker than how it would if you didn't have the vaccine. Third question, will the vaccine change my genes? No, the mRNA in vaccines cannot combine with our DNA to change our genetic code. Also, like I said earlier, the mRNA is instructions for how to build proteins. And alternatively, in the way that DNA works, DNA is kind of like instructions for mRNA, which is instructions for our protein. So it's kind of like downstream from how DNA works within our body to make proteins. So it's not going to work backwards to affect your DNA. And also mRNA is relatively fragile and will only hang around inside a cell for about 72 hours before being degraded. So it's not going to change your DNA at all. Next slide, please. Next question is, will I need a booster shot soon? So booster shots are common, as many of us have already received booster vaccines for diseases like chickenpox, tetanus, and whooping cough. Boosters are currently not recommended for everyone unless you have underlying conditions that put you at high risk, such as the ones mentioned earlier in the slides. Like I said, if you don't know if you fit into any of those categories, you can look on the CDC website for more clarification or reach out to your primary care provider. The next question is it safe to, is it safe to get the vaccine if I'm pregnant or breastfeeding? Short answer is yes. The CDC recommends vaccines for pregnant people after finding no increased risk of miscarriage. So the reason people were a little bit worried about getting this vaccine is they thought that the vaccine would cause a miscarriage if you are pregnant. But in studies between people who are pregnant and have the vaccine and people who are pregnant without the vaccine, there's no difference in the percentage or in the occurrence of miscarriages. So there is no increased chance of miscarriage if you do get the vaccine while you're pregnant. Pregnant and recently pregnant people are especially at risk of negative impacts of COVID, which is another reason why getting the vaccine is very important. You'd rather be healthy and have your baby carry along in a healthy way rather than getting COVID while pregnant and having like further complications. Last question is, if we need a booster shot, does that mean that the vaccines aren't working? No, this means that the vaccines are still working. They are still working to prevent severe illness, hospitalization, and death. However, public health experts are starting to see reduced protection, especially among certain populations. So like I said, the adaptive immune system in your body is going to take note and memory of that spike protein, but just like us and our memory gets foggy, your immune system memory could get foggy too. And so it's just starting to see a reduced protection, but still a protection there. So the vaccines are effective. Still, the booster shot just is for people who need that extra fight in them for the vaccine.
So I wanted to go ahead and give you guys a few resources that you can use. And this is one resource that I've been working tirelessly on is our COVID-19 toolkit. And this toolkit is a digital online toolkit that lives on CCUIH.org. And you can click that link there, CCUIH.org/COVID-19 toolkit, or you can just go on our website and you'll see it. But this toolkit is updated weekly with new public health graphics and new public health messages that me and Taya and our communications coordinator, Montana, have been working on. And we constantly, go up to date with new data and new resources that are coming out, and we make them adaptable for our American Indian Alaska Native communities. So it's very easy. You can go on the website and you can just download any of the flyers, and you can print them out and you can use the public health messages. They're free to use anywhere you want. We have a resource link library that's updated weekly with new resources surrounding a ton of things, whether it be mental health, vaccines, COVID-19, sickness, mental support, anything you can think of, it's in this toolkit. And if we are missing anything, then please do let me know, and I will go ahead and work to get that on there. but this is updated weekly, and you can find new graphics weekly and new images. And we break down how to create social media posts surrounding COVID-19 as well. So it's a really great resource. And it's like I've been working on it so much that I just push it to everyone. So please do go ahead and check it out and use some of the resources that are available there. And then the red I mentioned in the beginning of this training, the support line for all COVID-19 questions and concerns is available 24/7 for you. You can, it's the best resource, I think, the best resource that could possibly be for COVID-19 related stuff. And as Taya, like you mentioned, it's not just for COVID-19 stuff. It can be for anything else as well, whether it be trying to find a provider, trying to get mental health care, or trying to if you have substance abuse, or you really know someone who might need some help. This red line support is literally the best thing you could do. Like, just please give it a try. Please let us know how it is and how it works. And I don't know if you want to say anything, Taya, related to the red line and from your experiences.
No, I think you covered it all. Redline is just a really big one-stop, like it says on the slide, except for the CCUIH toolkit, but so wide, I'm going to take your words a little bit. But Redline is a one-stop shop for literally anything you could need as far as like mental health, COVID, help with anything, substance use, just a really good resource.
Yeah, so please do take advantage.
Can I ask a question?
Yeah, of course.
Are those limited to certain areas, or they, because they're online, are you able to take advantage of them for wherever you're at, or is it for Native communities?
Yeah, wherever you're at, actually, you can call this line. Like I had brought this up to our team before. Like, let's say we have someone from the Riverside, San Bernardino County area, and they just call for some support, and they need some help with getting substance abuse support, or they need to know where they can find a facility to help with this. They can most definitely take care of that for you. So if you're in California and you identify as American Indian, Alaska Native, then go ahead and call this line. But I would say that it is predominantly geared towards our Indian community, because the people on this line are actually trained in terms of our culture to really help those people out. So we have a team that specifically goes through different trainings in Indian country to really help our community. So if you're in California and you need some help, or you know someone, or you can even reach out for someone else as well. So this is just a really great resource to share, I think. And if one thing that we do have is we have like little pamphlets and cards. And if you need any of those, I can definitely mail them out to you guys, or whatever it is, so you have them on hand to give out. But it's definitely a resource that I feel will continue on and will be a great resource for the years coming, especially with COVID continuing much longer than we expected it to. Okay, thank you. That was really all we had for you guys today. We kind of wanted to just go through some data, go through some of the questions we've been seeing through the community, kind of touch base on a little bit of how you can talk to community members, some of the most important things that we've been seeing through firsthand experience of talking to a ton of people about COVID-19. And I wanted to go ahead and put this survey in here. It's an interest survey, and this interest survey is a live survey that we're using to gauge the community's needs. And this survey isn't about necessarily our training today, but it's just about COVID-19 and where you stand in the community and what you're seeing. And if there's any sort of resources, or maybe it is rapid tests, maybe you need more rapid tests in your community, go ahead and fill it out and say, hey, I'm located in Riverside, San Bernardino, and it would be really nice to get some rapid tests from CCUIH. Then we can go ahead and address that and mail out some resources and mail out some rapid tests and really whatever it is you need. So I think the survey is highly valuable. The survey is kind of what we'll look at to see where it is that we can really help communities out. So please do fill this out. Please do give it to other members who you feel maybe have something to say about COVID-19 or say about the services that we're offering. So yeah, if anyone has any questions, we're more than happy to answer questions now. I'm going to go ahead and stop sharing my screen, and I'm going to go ahead and stop that. Okay, there we are.